Can the WHO be reformed, or is there a better way for health, freedom, and sovereignty? So, Tess, I'll pass the mic back out to you to introduce our first speaker.
Well, I'm extremely delighted to have four wonderful speakers with us today, and we have Dr. Meryl Nass, we have Dr. Wahome Ngari, we have Dr. Astrid Stuckelberger, and we have Hari Hassan, all from different countries with different perspectives, and we're going to have a wonderful time hearing their perspectives and formulating our own decisions in terms of whether we think this organization is competent. So I'd like to introduce our first speaker, who I believe is Dr. Meryl Nass. Meryl, have I got that right? Are you ready to
I think
speak?
we were going to go with Astrid first because she's worked at the WHO. And of course, we're going to be taking a vote with our speakers after everyone has presented on the subject, can the WHO be reformed? But let's begin with Dr. Astrid Stuckelberger, who, like you, has done work at, with, or for the WHO. Go ahead, Astrid.
You're on mute, Astrid.
Your mic.
Right, sorry.
There we go.
I forgot
Astrid,
I had to...
Maybe you can tell us a bit about yourself first and then share your insights and analysis with us on the topic.
Yeah, so thank you for Shabnam and Tess for inviting me, and it's always a pleasure to be with you and with the people listening to you. So yeah, I'm entitled to speak about WHO, but not only WHO, but the whole United Nations system, which I have done since the beginning, because WHO is just a child of the UN. So yeah, I have many, in my CV, I have worked a lot, not only in WHO, but in the UN. What entitles me is because I worked in the IHR Alert and Emergency Department to implement the International Health Regulation 2005, entered into force in 2008 for almost 4 years. And not only that, I mean, I was been working with the Office of High Commissioner of Human Rights. So I have worked a lot with human rights. I was actually in the shortlist to become the special rapporteur for crimes just before COVID. And we were three, and it was the Chilean, because the head of the Office of High Commissioner is from Chile. And it's actually a blessing, because I don't know, I would have not lasted for a long time there because of what happened in COVID. But anyway, so that, and I have received a prize from Kofi Annan from the United Nations, because I have worked so much in the first part of my career on active and healthy aging with the WHO aging department. And we organized the International Year of Older Person for like 3-4 years. So I've been involved in many aspects of the whole United Nations system, not just one. When you take a silver lining, you can go from the rights to the development to the sustainable goals, and you see what is going on. And I've also been an NGO, academic NGO, until 1 year ago. So I don't need to say everything. And been teaching that at the University, Global Health and Human Rights with WHO and the UN. So your question, can WHO be reformed? And well, we are facing now on the 1st of June, it's a milestone, a historical milestone, because WHO is at the ridge of being trapped in their own violation of their own texts, or the violation of the WHO Constitution, of the Charter of the United Nations, of the Universal Declaration of Human Rights, and a really important breach on violating our sovereignty, national sovereignty, and natural law. So when you study that with lawyers, and I have worked with very enlightened lawyers who understand international law, not that only understand the text, you see that what WHO is doing is actually applied to the whole United Nations. Just a few days ago, WIPO just signed a treaty to patent all the genetic material. And I mean, the WIPO member states adopt historic new treaty on intellectual property, genetic resources, and associated traditional knowledge. They couldn't pass it, just to show you it's not about WHO only. So we have a systematic problem that I want to address, because everybody's talking about the text. The text includes the problem of the system. So the first and most crazy is the way that we as people are represented at the United Nations. And to be represented, we have non-governmental organizations who organize themselves as business, the bingos, as government paid, the gongos. We had a lot of names. So being in Geneva, I went a lot there, but I can say that there is really a problem of representativity of we the people. And that if we reform, this is going to have to shift the pyramid, the people first, that will decide how they are represented in any institution in the whole United Nations. Because one thing that is a silver lining is the way to vote. And that's the second step. It is the way to vote. You can see it in all the text, is 2/3 of the vote of countries. So 194 countries, if you count Palestine or not, it's 193. So you have 194 countries. 2/3 say yes, the whole world says yes. How come every country counts for a member of the whole civil society? This is a breach in sovereignty of the state. And this is where we don't give our power to WHO. If we are a country, we don't need to do that. We have to come back to our natural law and to sovereignty. So transparency and sovereignty and representativity is a huge problem. Then the most important at the moment with WHO is, I think, beside power transfer, you can look at all the agreements of the Charter we have been studying. We have a declaration that will be distributed this week and on Saturday of 7 pages. Beside the transfer of power, which is against the Westphalia in 1648 treaty, which does not allow you to give your sovereignty to an international organization. It also breaches the law on the Charter of United Nations, the WHO Constitution in the article, are even saying that, and even the pandemic agreement says that in Article 24 and 26, I think. The most important with WHO is that health is at the center of our lives, and health and disease is touching people in business, and it has become a business. So this means massive conflict of interest. And this is very worrying because they say, in the name of equality, we are inviting parties or associate members or a whole family of private sector without our consent. And they are orienting, and not only orienting today, they are directing WHO. So we cannot accept that. Just that fact, we have made that at the end of our statement. Just that fact, I will read you the end of the statement, allows us not to belong to the WHO anymore, and to not to ask our government not to do anything. So after the 6-7 pages, we say, therefore we need to put an end to the interventions of private partners and parties who find a financial interest or any interest contrary to that of peoples and individuals in their actions to WHO. Therefore, member states can no longer be bound to the WHO constitution while private partners guide the institution. And we finalize that as it stands, any action undertaken through WHO on behalf of member states and their populations will be contrary to the international law, will violate the sovereignty of member states and the natural law. And this has been signed by attorney at law Virginie de Araujo-Reicha, who is French, who took France as an example, and me as an expert of WHO of human rights and have worked a lot at the Office of High Commissioner of Human Rights. And we are involving now in all languages many lawyers, because the whole system is actually illegal, because they're making a one government business, I would say, to make it short. So, I don't know if that's enough, or you want. I don't want to take too much time. I don't know how much time is left.
You still have about another 10 minutes if you need it, Astrid. I think your insights are so valuable on the subject of the practicalities. Can it be reformed, or is there a better way for health, freedom, and sovereignty?
You see, when a house is organized with the rooms in such a setting that you have thousands of rooms that have other hundreds and thousands of rooms, you cannot just reform, because the procedures and the process that are in place and the people who are in it are really believe it. I did believe it myself until I saw a lot of breaches. But what happened since 2020, I'm sure that this is criminal. So I know that this is impossible, because it's too easy to take back power in the current situation. And this octopussy with so many branches in the United Nations, I think I made you a presentation or not on the whole United Nations system. You have the whole private business, you have the International Aviation, IATA, and ICAO, so they can control the airplanes, they can control the radiations, they can control the chemicals, the food, the right to food, the right to housing, the right to social determinants of health. When I've been in many of those departments of WHO only already, I can tell you it has to be simplified, because the most important is that the countries on the ground can apply their own sovereignty. What happened with COVID is unacceptable from the beginning. You cannot lock down the whole country with an epidemic that has not been proven country by country. And so that when we were doing this international health regulation implementation course, I was responsible of human rights, of health systems, of communication and emergency management. But when we did health system exercise, and it's adult, so I always do applied exercises in the Master of Public Health already. We have always had a very innovative way of teaching. Every country had to do a mapping of their health system, and we had epidemiological centers, the focal point of the HR, the focal point of the Ministry of Health or the WHO office, and they had to draw their own health system and imagine any outbreak, chemical, radionuclear, infectious, foodborne, and how would their health system work if you have a country with thousands of islands like Indonesia. The port of entry is not going to be the same as if you are in the Swiss mountains or Canada, or if you're in Botswana or in any of the countries that are totally contrasted. So it's just impossible. Culture is there to stay. Culture is very important. You cannot just standardize the whole world. And that's what I see as one of the very big risks, is to standardize the world with one government, the world government, one health. And we have to get that out. It's beautiful to have culture, different lands, and we have to be very careful also with AI, with the internet of solutions, the internet of things, the internet of bodies, the internet of everything, because data processing has, and I was addressing that as the EU a lot. I did booklets on that. AI and is processing data from home of people with innovation to the private sector, with data breach, data privacy breach all the time, with non-informed consent, especially with old people, when you have, non-discrimination situation with Alzheimer's disease or things. So this whole standardization plus internet innovation, which is good, but not AI, that you don't know where the data goes, like happened with COVID, vax, ID, even the restaurant knew who was your doctor or who was vax or not, So I see really a problem the way it's organized. It is organized too much on a hierarchical model of, the triangle at top. There are the big bosses that decide for everything. The countries are just, the pouch for the business, and we are the product. This is how I see the problem. We need really to get back to a completely different system. I don't know, Ubuntu in Africa, you have great models, but yes. we cannot. I was with Africans and they were talking about that. I said, oh, that's great. How can we get back to respect of natural law? And when I talked with Virginie Desarroges-Orecha, she says, she's the specialist, she said, natural law, the right to life, is the highest law of all. It supersedes any international law. They have put upside down the system that international law is higher than national or individual rights or natural law. So we cannot just reform. We need to dismantle, to imagine another world and imagine another system of communication that where you don't have your data breach and surveillance and monitoring system 24 hours on 24 by machinery. So I'm really not for reform because, first of all, WHO is not enough. You saw WIPO, the World Intellectual Property Organization, which is here too, and I've been there too. We cannot. This has to all stop. We have to say in the name of people from today on, like we said in our conclusion, no action, no signature is valid anymore in the whole United Nations system. It's not possible that the Security Council with 5 countries with veto can direct the whole world, even if they say it's proportionate to the population. This is not acceptable in our natural conventions law. So I think that I've said many keywords, and I can only wish that people get educated more on what's going on so that we can turn around this pyramid of power to get the inner power.
Yeah, thank you so much, Astrid. I think the ordinary person is really astonished to hear that the World Health Organization is, that there is this power grab going on, and it's very hard for them not to believe their governments when the governments are saying, well, it doesn't affect sovereignty, and don't worry, we won't give away your sovereignty, because the World Health Organization hasn't really featured terribly much in the lives of ordinary people. It's sort of been out there as something extra, that doesn't influence government policy, generally speaking. It's so I think it's sort of a lot for people to take on board, suddenly hearing that their sovereignty and their national sovereignty and individual sovereignty could be handed over to the World Health Organization in another pandemic, or let's not even use that word, I mean hoax or public health emergency of international concern that gets declared. So what would you say to people who would say, well, this really has nothing to do with me, I don't care about that big organization, they can go and sign their papers and all of that, it doesn't affect me in any way? Is that a helpful position to take, or is that a position that's going to leave you sort of blindsided and actually handing over sovereignty?
Yeah, you're right. It's a very good example. They think it's the big machine there, we don't care. But actually what happened, I think the example of what happened since 4 years is to be taken seriously. And they have breached all the laws in what they did. So I think everybody knows what went on. And the lockdown, for example, is totally illegal. They know they have, people who are very sick after the jab, and all those measures of time can happen again and again. The proof is not even been evidenced. But when you talk to them, we have to show them that that's just an example of how their representative, the Prime Minister of Kenya and Geneva, of Panama, of USA, they are all sitting in their chair with limousines, going to parties every national day, and they're 194, so they all have. I've been to some of them, but it takes so much time that it's not possible. So there are two worlds between diplomacy, what's called diplomacy, and the people on the ground, and they have to understand that they take decision. And you don't know how they take decision on the people. And that's what happened exactly with COVID. It's exactly what happened. So what happened already is an example to demonstrate to them that they can come and take their land in the name of, it is polluted because we found some chemicals in your ground, so we have to depollute it, you have to get out of here. We know they have lied. We know the PCR is not an instrument of diagnosis, and they lied to us. 97% of positive cases. This can happen in many areas. Their home, their water, their food, everything that belongs to life is trying to be hacked by the system. The thing of the WIPO is appalling. They want to patent the living. They want to vaccinate all the animals, take off the plants, put electric synthetic life instead. And I see that. But it's true that when you explain the whole system too fast, they can get very scared. I would just say, you need to come and protect the natural rights. Your life has to be respected wherever you are. The right to live, the right to breathe, to eat, to keep your children, to have your children educated the way you want. The government has nothing to say to the education, you know, and etc., etc. And you can go on, you can go farming, you can sell if you want, you can live as you want. And I think one of the problems is the taxes, because they have overstated taxes and they keep on, when we should be living a much easier life. So I think when you take those examples, you know, from farm to food, from, you know, go and cook yourself, everybody should be able to have a nice life and have their rights respected, but that's not what we see. And no, there's a big danger.
Thank you,
Thanks very much.
I must say, when you reference Ubuntu, it's really quite special. As we say in Africa, Umuntu, Gumuntu, Gabantu, I am because you are because I am, we are because of each other. So thank you very much for your very valuable contribution.
Nice, beautiful. Thank you for inviting.
Yeah, thank you.